Hello and welcome to the True Lessons overview of the OET Writing Test. Now, what is part of the OET Writing Test? Actually, it's only one letter and it's a referral letter. It's a formal letter that you as a professional will be writing to another professional or to a patient or to another caregiver set in a healthcare environment that you are experienced in. Therefore, if you're a nurse, you will be writing a letter to a doctor or a caregiver or a senior nurse on how to manage a patient. If you're a pharmacist, you will be writing a letter to a doctor or a nurse or a patient about how to manage the patient care with the medication or therapy that you have provided. Similarly, physiotherapist will have to talk about physical exercises and care and so on and so forth. So you will be in familiar environment. So the OET writing test is a 45 minutes test where you will be given all the patient details, that is his or her name, age, health history, and sometimes even the social background, because sometimes it's a single mom, is an elderly patient, there's a patient who is living alone with no caregiver, and so on and so forth. Then sometimes economic conditions are also mentioned, because then you will have to recommend the way how he will manage his treatment. So what funds does he live on? I mean, are these student funds or is he on state pension and so on and so forth. Then many other extra features like is he or her allergic to anything, or is this an asthma patient? Is he addicted to smoking? Is he an alcoholic? And so on and so forth. So these things will also be mentioned in the notes. So you will have to compile a letter based on these facts. Also, you will have to refer to the notes and to the task given. Who are you going to write to? And what are you going to put in the letter? So this test you have 45 minutes, and out of that we recommend that you use 5 minutes to read all the notes. Take great care in reading the task. What are the features that you have to put into your letter, and also what is the patient background? Read very carefully. So I will be giving you an example. I will shortly put up a writing task for a pharmacy candidate, and you will notice how it is formatted, how the task is set up, and what are the features you have to pay attention. So here you can look at the details, and first actually go quickly over the patient detail. Okay, and so the patient details, that is, it's about a 2-year-old child, March, and you're going to prescribe an electrolyte replacement. You will also see an entire the notes will describe everything about the product that you are prescribing, and then this you can skip over quickly and go to the actual task. Now, what does the writing task say? It says you have to write 180 to 200 words. It also gives you the name of the person you are writing to and the address. So pay attention to that. Then in your answer it says expand the relevant notes to complete sentences. Now the keyword here is not the task itself that expand the relevant notes. The keyword here is relevant. Relevant means you have to pick out certain areas from the notes that are given that are relevant. That is, when you're writing a letter to the mother of this child, what are you going to explain? So it's evident that in the task, the mother is not a pharmacist or a doctor or a healthcare person. So you have to make it very simple. Give simple explanations on how to manage her child. So now we will go to the product information, and out of that we pick out some details like how is the drug to be administered. That is, you have to mix it with 200 milliliter water only, and you can't mix it with soda or juice or soft drinks. All that is relevant because the mother may not know how to mix this into water. Then it also in the reconstitution part, it also tells you how to mix it, when to give it, when to throw it away, should be discarded if it becomes old, and so on. Very importantly, what is the dosage? This also you have to pay attention to. And pre, post, current, when the treatment is going on, what are the precautions you have to take? That you shouldn't eat solid food, you shouldn't be giving the child, any heavy food, and you should only give fluids, and so on and so forth. So these are the areas that you have to take care and pick out. Now the second part of the task says you have to not write in notes format. Therefore, the way it is given here, just in single half sentences, you cannot write it like that. You have to now make complete sentences as if you are writing to a person who does not know much about how to manage the kid and also doesn't know how to administer the electrolyte that you are prescribing. Now the third and final thing is it should be in a letter format. Now there will be different referral letters for doctors. For example, then you will have to examine the patient. There will be clinical findings which you will have to note down in the letter, and then you will have to write what is the way to manage it. Sometimes if you are referring the patient to another doctor, suppose it's a nurse and you found there's a swelling, and what part of the body is there swelling, what do you suspect, every single thing you should mention in your referral letter. Now also pay attention that you have to mention everything that is in the notes and not make up something from your imagination. That is because you would have seen other patients, so you can't just say that, oh, I think this is my diagnosis and this can be done. You have to actually exactly copy whatever medication is prescribed or whatever they say, the pain management or some exercises that they will prescribe. You have to put it verbatim into your referral letter, which means that the letter as such is easy to construct, but use only information that is available in the notes section. Pay attention to the tasks and make sure that your word limit doesn't exceed, or don't make it too short. And I think usually nobody goes over time, because you can easily write 200 words in 40 minutes, because you are all professionals and you would be seeing patients and you would have written letters like this. So it's pretty simple that way. Okay, time management is not the issue. Task fulfillment, I repeat, is the bigger issue here. And make sure you write complete sentences and make sure it is a letter format. If you like my video, please subscribe to all our social media handles. Press the bell icon and subscribe to our channel also. Thank you very much.